This is Ed at Lucky Glider Rescue and Sanctuary, and today we're going to show you how to syringe feed a glider, and specifically we're going to show introducing a liquid antibiotic orally to a glider, which is essentially the same way you syringe feed a liquid soup to a glider that's not eating. Pretty much the same procedure. So the first thing you do is you've got to shake up your medicine. Typically the antibiotics are in liquid form. And you cut the top of it so that it just fits the syringe, and you suck the amount in there that you need and push out the excess. We need 0.03 milliliters for this application. This little glider, Sasha, got a mating wound on her back, and it's quite natural for that to happen. It's normal for male gliders to bite down on the back of the neck of the female. Despite the fact that this male was neutered, after they're imprinted with that behavior, they continue to do it. Nonetheless, from time to time, they'll get a little bite, and if that little bite overnight, has a break in the skin, the other gliders in the colony will pick at it and groom it and attempt to clean it, and in doing that, they make it larger. And if you don't check your glider every day, every night, every morning, check over the gliders, make sure they're all okay, don't have any lesions or cuts, an infection could get going, an abscess could get going, necrotic flesh could happen very quickly, like within a day or two. So you do want to inspect your gliders. And Gail inspected the princess and dwarf colony the other day and found that two of them had contracted pretty nasty wounds, and a third one had a hidden one. Now she's a little complaining because the doctor had to clean up her wound. I'll show it to you. That's it right there. And we're going to do hydrotherapy on that every day, where you simply hold that portion of the wound under water, under tepid room temperature water, and it flushes out the wound, cleans it a little bit, and promotes the granularity. And you want that when the wound is healing. That's not a wound that's big enough for sutures. In fact, a lot of vets don't want to suture a wound like that because the abscesses happen very easily on gliders. So they prefer sometimes to leave it open. So anyway, you hold the glider gently against your chest. You stroke them a little bit and let them know you care about them. Just kind of caress them a little bit. And then as you hold your hand on top of them like this, you can work your thumb underneath them, underneath to the chin, while you put your index finger on top of their head. And then it's easier to hold them. So now I have my thumb underneath its chin and my index finger on top of its head, and I'm holding it pretty tight. And it makes it a lot easier to then put the syringe on the side of the mouth, wiggle it a little bit, and they'll open their mouth. No, honey. No, you're not cooperating. And then you just squeeze it in, and they'll swallow it. Okay? It's that easy. That's a good girl, Sasha. You're a good girl, honey. You pushed it away a couple times, but you're still a good girl. Okay. Go ahead, back in. So that's how you do it. It's pretty much the same procedure for syringe feeding. A half a syringe full of high-protein soup, or a mixture of yogurt, honey, and orange juice, for example, if they have a hypoglycemic attack and they need a little bit of glucose in them. But so you end up using a syringe for quite a few things. That's the way to do it. Remember, you get your thumb underneath the chin while you're holding the glider down. You slide your thumb under by their belly. Get your thumb positioned under their chin, get your index finger on top of their head, flip them over, belly up, wiggle the syringe into the side of the mouth, and just plunge it right in, and then they'll swallow it. They have a natural tendency to swallow when there's liquid in their mouth, so they're not very likely they're going to spit it out. Okay? Thanks a lot, and tune in for more later.